Lower back pain. It's a huge issue in our society, costing millions in medical bills and time off work for people, and it has many, many different causes. We see it often in our office, and one of the causes that we see quite frequently that's often missed by people is tightness and or weakness in our hip flexors. As we sit more and more as a society, our hip flexors become tighter, they become weaker, and they influence the state of our back and back pain more and more often. In our office, we see it with increasing frequency. In this video, I'm going to explain to you what your hip flexors are, how they relate to lower back pain, and then some exercises that you can do at home to stretch out those hip flexors and to also strengthen them so they're not tight, they're not weak, and help eliminate a lot of your lower back pain. Hi, I'm Dr. Scott McCrimmon, a chiropractor with Caledon East Family Chiropractic. Our channel is devoted towards giving you and your family the latest, most up-to-date health tips to keep you healthy, active, and living that pain-free, happy lifestyle that we all deserve. If you like the information that you see in this video or in any of our other videos, please feel free to give us a like, hit the subscribe button, and stay up to date with our latest videos as they come out every month. Okay, so your hip flexors. What are they? Well, hip flexors refer to a group of muscles generally located in the front of your pelvis and hip, and their job is, as you guessed it, to flex the hip, which is this motion here. Anything that brings your knee up towards your chest is called hip flexion, and so those muscles, because they attach from mainly your pelvis to your leg, as they shorten, they pull everything together. When we talk about our hip flexor muscles, there's sort of 5 main ones that I'll say we consider. There's a few other ones that help, but the main ones are something called your rectus femoris, which is one of your big quad muscles, that big muscle that runs in the front of your leg. One called sartorius that just runs across the top of it, but a skinnier muscle. You have your TFL, which is part of your IT band, for people know what that is. But when it comes to hip flexors and lower back pain, the one we really want to talk about is something called our iliopsoas muscle. Our iliopsoas muscle is made up of 2 muscles. So our iliacus that runs off the side of our pelvis here, and our psoas muscle, which attaches all the way through your lumbar spine and your lower back. They join together to come down and attach to the front of your leg. So if we're looking at me from this position here, your psoas comes down this way and joins with the iliacus and comes down to attach to our leg. So as they contract, they start to pull this leg up in this direction here. This is a very big, strong muscle that really can put a lot of tension and torsion on your lower back when it gets tight, as it starts to pull everything together. So because the psoas muscle attaches directly to your lower back, we have that direct connection from our hip flexor muscle group to our lower back, and there's a relationship there that can lead to lower back pain. So how does that muscle create pain in our lower back? When we look at muscles, a couple things that can happen to them. Sometimes they can be chronically stretched, which kind of makes them weaker, or they can be chronically shortened, which makes them tighter and loses range of motion and puts more tension on the ends where it attaches to different parts of our body. In the case of our psoas, there are different reasons why it can create low back pain, but the most common is from prolonged sitting. So we talked about this being our flexed hip, which shortens our muscle. So that muscle runs from deep in here down to the front of our hip. So as we bring this up, that muscle becomes shorter as the 2 ends pull together. When we sit or we drive for long periods, day after day, that muscle it gets chronically shortened. So now it's tighter. So when we need to do range of motion and stretch it, it doesn't want to move quite as well as it should. So when that psoas muscle gets tight and doesn't want to move, as we try and go through that range of motion, it's going to put the stress on the ends of the muscle where it attaches. And we know that psoas muscle attaches from our spine, running right down to our leg. So as it tightens, if it's tightened on one side, it can start to pull our spine in this direction. That can happen from the way we sit, maybe we play a one-sided sport, or just we have poor posture that we always lean to one side. If both sides are tight, it can actually start to make changes in this normal lordotic curve in our lower back that we're supposed to have, which is really important. Either way, when we have that stress and it's pulling on our spine chronically because it's so tight, that's going to create stress on the joints, the nerves, the discs, all these things that can generate pain in our lower back. So the tighter it is, the longer it's been tight, the more likely it is to create trouble in your lower back. So if you are somebody that sits a lot, drives a lot, maybe play a certain sport or a work activity that's causing your hip flexors to be quite tight and you've got lower back pain, well, there's a good chance your hip flexors may be the cause or at least be involved. So what can you do about it? Well, if you have chronically tight muscles, one of the best ways to get started is to have a good stretching program for those muscles. However, I'm also a big believer that not only do we need to stretch tight muscles, it's also really good to strengthen them. That's going to help support them and allow them to function even better. So I'm going to go through a few stretching exercises that you can do, as well as some strengthening ones that are easy to do at home. As always, consult your healthcare practitioner. Make sure these exercises are right for you. And if they're causing you pain, discomfort to do them, definitely stop and get that checked out. Okay, so let's start from easiest and work up to a little bit of a deeper stretch. A really simple stretch you can just do at home, laying in bed for hip flexor, is to lay on your back on your bed, slide yourself over to the edge as close as you're comfortable, and what you're going to do is you're going to let the affected leg just hang off the side of the bed. And even right there, I'm starting to get a nice stretch through my hip flexor there. If I want to add a little bit more, I can pull the opposite leg up towards my chest, keeping this leg just as relaxed as possible. Let it fall down towards the ground, and you'll feel a nice stretch through the side here. As always, I like to hold these stretches for at least a good 30 seconds, let the muscle really stretch out. And you can always do the other side and do a few reps of that whenever you can throughout the day. That's a good start to help stretch that hip flexor out. Okay, so the next stretch we're going to look at is sort of our classic runner's type stretch. So on the floor, I like to put a pillow or a towel or something, just the floor can be kind of hard. So from our knees, what you're going to do is you're going to put one foot forward. Actually, I'll show you the other one. Put one foot forward here, chest upright, and all you're going to do is just gently lean your chest forward, feeling a nice pull in the very front of this hip. Okay? Don't overstretch, don't make it too tough on yourself, but just enough. And the further you put this foot forward, you can extend down in, and you feel a nice stretch right through the front of the hip, right through those hip flexors. Again, try and hold that for a good 30 plus seconds, keeping your body upright. Avoid a tendency to want to hunch over, which again, you're shortening that muscle. We want to keep upright to help stretch it. I'm just going to show you that same stretch again, just from the front view. So you're going to bring one foot forward, keeping your chest nice and tall, just lunging forward slightly. What you can do to add a little bit more once you feel that nice stretch, take the same arm of the leg that's being stretched and just reach over gently, bending your spine away. Because that muscle attaches to your spine, you need a little bit of an extra stretch, again, right through the front of your hip flexor there. Now, for those of you who want a little bit of an extra deeper stretch in there, maybe a little bit more flexible, but still need to stretch your hip flexors out, you can take your bent leg or your back leg, and you can put the toes up on something, a chair, a bench, anything behind you. That's going to give because it stretches more of the quads, like we talked about that rectus femoris and sartorius that are part of our hip flexors, that's going to give you a little bit more of a stretch in there, get that stretch a little bit deeper. So stretching our hip flexors is really important. Now that we've gone through a few stretching exercises, it's also important that we strengthen them to help give them proper stability. So, because our hip flexors run they're in the front of our pelvis, and we know they want to pull our knee up towards our chest, in this motion here, that's how we want to work on strengthening them. Anything that bends that hip up in this direction. So, a really simple, easy one to start is just a regular march. Stay in a nice tall position, core tight. All you want to do is bring one leg at a time, just up above 90 degrees. Very easy to do. You can easily do 15 repetitions each side. That's going to start to activate your hip flexor muscle. If that's really simple and easy for you, you can make it a little more challenging by, if you have ankle weights, you can add ankle weights to your feet to make a little more resistance coming up and down, or you can use an exercise band. If you have an exercise band at home, if you have one of those mini bands, or in this case, I just took a regular exercise band, tied a knot around it to make a loop, what you can do is you just put the ball of your foot through one end, stand on it with the other end, and then as you do your march, you're going to get some resistance from that band, and you can just repeat that same exercise, 10 to 15 repetitions on one side, flip the loop to the other foot and do the same there as well. Okay, just a couple more exercises to show you that you can do for strengthening. Again, any exercise that we can do laying down, I'm all for. So I'm going to show you a couple more that you can just do laying in your bed or laying on your couch. So, we lay on our back, and from this position we know anything that brings our leg upwards is our hip flexor, so you can do what we call a straight leg raise. Laying on your back, again, we always want to keep our core nice and tight, and you're just going to raise that leg up and back down. I like to keep it in about this range here. You're just going to activate that again, 10 to 15 repetitions each side. That'll do some good strengthening work. From there, you can move on to more of a bent straight leg raise. If you've ever watched our core stimulating exercise, we had something called a dead bug exercise, and this is kind of part of it. You bring your legs up, both at 90 degrees, and one at a time, lower down to just above the table, bring it back up. So the whole motion of slowly lowering and slowly bringing back up is going to activate your hip flexor muscles and start to improve their strength and mobility in there. The last exercise I'm going to show you, it's a bit more of a glute exercise, but it does involve giving a stretch in your hip flexors and does work on our core, and our core is super important for anything to do with lower back pain. That's just our glute bridge. So from this position, since we're already down here, we can do 10 or 15. Lift your legs up, try and get that stretch through the front of your hip while you're contracting your glutes and your core. Come back down, and again, reach up, come back down. That's going to provide a nice stretch through your hip flexors as well as activating your core, which, as I mentioned, is always good for lower back pain. Okay, our hip flexors. We now know they're a group of muscles in the front of our hip and pelvis. They attach from our leg to our pelvis and our lower back. When they're tight, they start to pull on our spine, creating discomfort, stress, strain on our joints, our nerves, our discs, all these things that create pain in our lower back. They get in that short, tight position most often from prolonged sitting. So if you have a job that's sitting or driving, or you have poor posture, or we'll even see it from sporting or work activities that put a lot of stress through our hips and our pelvis. So if you have those jobs and you've got lower back pain, really consider your hip flexors as a potential source or a contributing factor to your pain, and really do the things necessary, such as stretching those muscles and strengthening the area to give support and stability through the exercise that we've shown you in this video. As always, I certainly hope you have found this information useful to you. And if you ever have any questions about our videos or certain topics that you would like us to cover in future videos, drop a message in the comments. We'll respond as quick as we can, and we're always happy to help you out. Until next time, stay healthy, stay active, and be well.